Hey everyone, thanks for coming back to my channel. I am your fave nurse B. In today's video, I want to do something a little bit different and show you all how you can use study templates to make studying a lot more easier, a lot more organized, and also it helps your notes just to look really good. I have these templates available on my website. They are downloadable. You can just download them and print them. I have different colors, different designs as well, and I'm going to be adding more to the site. I created these for that student who might not have the time to write out concept maps or just doesn't have the time to just make a template themselves. This is really quick and easy. You can take them while your professor is lecturing. You can take them as you're reading your book before you go to class or after class. You can take information from your PowerPoints and put them right on the template. So let's just get right into the video. So the supplies that I'm using is some correction tape from Staples. It's my favorite freaking whiteout, you all. And then I have this calligraphy pen. I'll put all the links to everything in the description box. You don't have to use it. You can just use a regular Sharpie, a highlighter, and then also I like to use the Crayola color tips in case you don't want to use highlighters because they have so many colors and they're really inexpensive. As well as one of your favorite pens. I like to use these Precise V7 RTs because they have a really thin tip, and I also like to use the Sharpie pens because when you're taking notes, sometimes it could just be a lot of information. So when you're doing pharmacology, you want to separate things from the actual drug name. And you want to look at the generic name as well as the brand name. You want to memorize. You want to memorize both names because on NCLEX, they might have just one name or they might have both names. They might have just generic or they might just have the brand. So you want to make sure you know both of them so you don't get tripped up, especially in the actual clinical setting. You know, the doctor might say, I want omeprazole 20 milligrams. And you're like, what is that? You know, it's Prilosec, but if you don't remember both of them, you know, you're going to look kind of silly because, you know, you need to know both of them. So you want to know both drug names as well as the drug class, because once you learn the drug class and you know what that drug class does, it really helps you to understand any drug that falls within that drug class. So it's really important to look at your drug class and know what class the drug falls into. And then, of course, you want to know the action. How is this drug going to work in your patient's body? Okay. And really important, what are the side effects so that you can look for these side effects, or you can also teach your patient to know about the side effects. And then, of course, the different uses. Why are we using this? Here, I'm talking about proton pump inhibitors. So one of them is Nexium, one of them is Prilosec. And, of course, one of the biggest uses is GERD or GERD. But, yeah, you can use highlighters. You can use pens, different colors and all that to make your notes look really fun. But I wanted to, do something different and use different prints for you all and different colors just to make your notes more fun. And I made sure that I actually put the font for each category. I made the font small so you could have as much room as possible to write your notes out, especially if you are a student who has, bigger handwriting. I wanted to also add that, of course, with drugs, you always want to know the patient, teaching, and the nursing considerations or the labs that have to be done when you're doing pharmacology. So for patho or med surg, of course, you want the name of the name of the disorder or the disease, any type of diagnostic test or labs that are taken in order for us to diagnose this disease. The pathophysiology. So how is this disease occurring within your body? Like what's actually happening when a person has this disease? Any risk factors is super important to know risk factors when it comes to med surg, because that has a lot to do with patient teaching, because you want to help to prevent certain diseases. And when a patient comes to you and tell you about their lifestyle and they tell you their signs and symptoms, you have a better idea of being like, you know what, this person is at risk for this. They might have this disease, so it just really paints the picture for your patient when you know the risk factors. And then, of course, signs and symptoms, because as nurses, we treat signs and symptoms. And that's what we have to look out for. So you must know the signs and symptoms. And when you're looking at signs and symptoms, really pay attention to the ones that set that disease or that disorder apart from everything else. Those are more than likely are going to be the ones that you find on NCLEX or your nursing school exams. The ones that just seem kind of odd, that's really what's going to be on those tests. And then, of course, you want to know, how are we going to treat this disease or disorder? So you want to know treatment and medications. And then lastly, patient teaching and nursing considerations is big. We want to be able to empower our patients by teaching them, how to deal with this disease or things to look out for. And then as nurses, we need to look out for certain things as well. So when you're doing your notes, don't beat yourself up when it comes to you making mistakes. I always just keep my whiteout on deck. Make sure you keep that in your nursing school supply arsenal. And I do have a video talking about nursing school supplies, so go check that out. I'll leave a link for you all. I hope that you all are able to get these templates. Thank you to everyone who has already ordered them. In the meantime, go check out my website, www.yourfavenursebenumber1. Yeah, that's my Instagram. Your Fave Nurse Be Number 1 is my Instagram. But my website is www.yourfavenurseb. I will be adding more content and also more products and services for you all. I hope you all are able to get these templates. So yeah, thank you again. Thanks for watching. I appreciate you all. And that's basically what you need to know when it comes to pharmacology and med surg. There's other things that you can add to it. And I made it so you all can have some space in case you wanted to add in another category to these templates. But I definitely suggest you get them and also store them in one of these plastic little sleeves, because they will keep your notes precise and pristine. And I know some people that like to do their notes online or on their iPad or whatever, but you can do that. That's totally fine. I mean, that's the eco way of doing it. And you can actually download these templates and just write it in on your iPad. You can definitely do that. But to me, actually physically writing them down on a piece of paper is very helpful. But writing them on your iPad is great too. So yeah, that's that. Let me know if you all have any more video requests or any questions that you have in the comment section. As always, thank you so much for your support. Go join the Your Fave Nurse Be Facebook group, as well as follow me on Instagram at Your Fave Nurse Be Number 1. All right, you all. Peace.